Does your personality have a bearing on your hair loss treatment? We will be discussing just that. Does your personality dictate your compliance to medical treatment after the hair transplant is over? Is knowledge about the patient's behavior patterns crucial to hair transplant results? Why is it important to talk to the patient in great detail before a hair transplant or just merely giving hair loss treatments? Consulting thousands of patients over the last 15 to 18 years, I have found that there is a set pattern in how patients behave, the response to medical advice, the response and compliance to medical treatment, and also how they respond to hair transplants. And then I discovered that behavioral patterns have been noted long time back, as early as the 4th century BC by Plato, when he describes his forms of intuition as templates for intuitive thinking. In the modern age, Carl Jung, a modern psychiatrist and thinker, suggested that archaic forms of human knowledge have deep roots in your ancestry. He believed that the human mind retains fundamental, unconscious, biological aspects of our ancestors. These primordial images, as he called them, serve as a basic foundation of how we behave in a given situation, and this is different for different personality types, or what we call as archetypes. Carl Jung divided the commonest personality archetypes into 12 categories, which are the hero, the caregiver, the creator, the everyman, the explorer, the jester, the innocent, the lover, the magician, the outlaw, the ruler, and the sage. When we dive into these behavior patterns or archetypes, as narrated by Carl Jung, we are better able to understand or appreciate the psychological needs of the client and deal with them in a better manner as far as medical treatment, forms of surgical hair restoration, acceptance for hair transplant, and compliance of hair transplant treatment after the procedure are concerned. For example, the patient's unique diverse responses just to mere finasteride will have a deep bearing on his personality type. The personality, as we all know, shows up more clearly when a person is undergoing stress. Now, with most of the patients, before they come to you or after you have suggested them the treatment after hair transplant, will go through the internet and find out all about the drugs that have been advised. And when they hear about the stories about Finasteride, which as we know are bloated out of shape, they will undergo stress. And that is when the actual personality of the patient comes into fore. So it is important for the doctor to understand that personality type, and only after understanding the personality type, recommend treatment for better compliance and better results. So I seek to classify the response to finasteride in patients when they are first suggested the finasteride, and after they have undergone research, talked to friends, and thought over it for a few days, into 5 categories. Now these are the Finasterophile, the Finasterophobe, the Finasteride ambivalent, the Finasteride ignoramus, the Finasteride cynic, and lastly,
here we go, Wilson. You don't have to worry about anything. I'll do all the paddling. You just hang on.
the Finasterophile falls in the category of the Carl Jung explorer or the hero, who is an optimist. He's honest, candid, and brave. They see good in every situation. They are a ray of sunshine in anyone's life that they touch. They are confident, responsible, and in control of their lives. There is no problem in this category of patients. They are very compliant to treatment, but they need to be constantly checked for taking overdosages of finasteride or switching over to dutasteride, which is a stronger drug. This group has never been seen in my practice to complain about the side effects of finasteride. And then we go on to the finasterophobe. He is the innocent who is optimistic, honest, and humble, and feels the most wholesome things in life are unadulterated and pure. They fear being unnoticed, unloved, and unwanted, and because their passionate desires cloud their judgment, they can easily be misled. They will not trust the advice about finasteride, they will never listen, and will never expose themselves to finasteride. Their mind rules their body, and merely sniffing on these tablets will make their breasts feel tender and the testicles ache. Well, this is a finasterophobe. And then we go on to the finasteride ambivalent. The finasteride ambivalent coincides with Carl Jung's The Sage archetype, and whose motivation is that the truth will set you free. He is knowledgeable, assured, and would believe in facts and experiences more than hearsay. He would take finasteride but with cautious optimism. Sometimes I have to tell them to go on a month's trial and see if they have a problem. If they do not have a problem, the drug can be continued. They never complain unnecessarily. Mostly they take to the medicine rather well and never have side effects. And then we proceed to the Finasteride ignoramus. Carl Jung's The Everyman is friendly, humble, and authentic. They are honest and pure and have no ill will towards anybody. They don't hold grudges and believe everyone has the divine right to be who they truly are. Once convinced about the need to take finasteride, they will start taking it, but if another person convinces them to the contrary, they will stop immediately. And then we go on to the finasteride outlaw. He is explained about the need to take this finasteride drug for hair loss treatment or after hair transplant. And the final decision should be left to him, and we should not try and convince him overly much because then he will not take the drug. He may sound cynical, but patients usually comply to medical treatment. They have a disdain for conformity that would remove any form of their freedom of choice, or for that matter, anybody else's. They are good at the core, but anger is part of their motivation, which at times can become their dominant force. Without a fight, this category is lost. And lastly, we come to the finasteride castaway. These are the patients who are not to be recommended finasteride, even though they are ready to take the drug because of certain diverse conditions which are unique in their physical self, like for example obesity, like for example diabetes, pre-existing erectile dysfunction, body image dysmorphia, and a host of other psychological problems. In these patients, finasteride should not be exhibited, and they are the ones who will have side effects with finasteride very commonly. The understanding of what drives a patient to a particular personality type allows a hair transplant surgeon to understand his basic underlying personality and what drives his goals, his objectives, his behavioral patterns, and motivation. A good assessment born out of detailed counseling will arm us better to deal with the patient for achieving better compliance, better results, and better overall happiness. Well, thank you for watching my video, and if you have any information that you seek regarding hair loss in general and hair transplant in particular, do leave a comment below and I'll be too happy to answer to each and every question. Thank you for watching and God bless you.